Just because cholesterol is at the scene of the crime doesn't mean it's a perpetrator. When it comes to LDL lowering, that is absolutely not part of what I do as a cardiologist, because the data tells us when you correct for what we call triglycerides and HDL, which are all linked to insulin resistance and can be rapidly improved with diet, LDL is not an independent risk factor for heart disease.
This is false. We can turn to the PISA cohort, where they looked at people without traditional cardiovascular risk factors like diabetes and high blood pressure, and this population had healthy HDL cholesterol and triglyceride levels. And they found that as LDL cholesterol levels increased, so did the rate and extent of the atherosclerosis, or plaque buildup in the arteries. They then went further and looked at people with optimal cardiovascular risk factors, not just normal, and the results were pretty much the same. So this supports that LDL cholesterol is an independent risk factor. On top of that, lowering LDL cholesterol by almost any means, including diet, statins, or other cholesterol-lowering medications, also lowers your risk of having a major cardiovascular event like a heart attack. That'd be quite the coincidence if LDL cholesterol wasn't playing a central role.
It isn't just about the fact that lowering LDL has no harm. We know, certainly in older populations, that actually there is a correlation between LDL cholesterol and longevity. So the higher your LDL,
exactly,
if you're over 60, the longer you're going to live statistically.
Absolutely.
It is true that lower LDL cholesterol is correlated with mortality in older age, but we can't just assume that that means that lower LDL cholesterol causes death. There are many illnesses like cancer, certain liver diseases, and infectious diseases that can lower LDL cholesterol and kill you, but they don't kill you because they lower LDL cholesterol. They can kill you through other mechanisms. And some of the best evidence that lower LDL cholesterol isn't causing an earlier death are Mendelian randomization studies. These look at people with genetically higher or lower LDL cholesterol levels throughout their entire lives. And they find that those with lower LDL cholesterol levels tend to have a lower risk of mortality and a greater lifespan. If having a low LDL cholesterol was so bad, we'd expect the opposite.